You know, when we sat around at the table deciding what kind of series we could give to our readerships that would really help them and serve them, there was no doubt, I don't think, that healthcare was the number one for caregivers who are newly in this situation dealing with someone with dementia or who've been at it for a long time. So we went out to give it to them, and we had to sit around and think about what are the categories that people in this situation need, whether you're a mother, daughter, sister, friend who's taking care of someone who recently got a diagnosis. Where do you need to go? And you're starting with memory clinics, and you're moving on to patient care navigators, and then you're exploring the private system and the public system, because in Canada there are both. And you know, how do we take this huge thing apart, divvy it up amongst the reporters at the table, and come back with stories that would be some kind of helpful roadmap for anybody, whether they had the diagnosis for themselves or we're trying to figure out how to help somebody else get through it. So we sat around and we all took the story, we all had our role to play, and then go out and find out and phone people, interview people, walk through clinics, email people, download whatever resources were available, chew them up and spit them out, and try and put yourself in the position of somebody who was a caregiver of someone with dementia. It was hard sometimes, and other times it was really moving and amazing. Like, you would come across a particular doctor or a particular social worker who was just so passionate and committed to making the lives of other people better. So I think the idea always was, we know these people and these resources are out there, let's go find them and put them into stories. And I think we did. You know, I've been, I think like most people, pretty lucky. Not a lot of experience with the healthcare system yet. You maybe have children who break a bone, you maybe get a cold, or you have to go to your doctor. All of a sudden you're talking to people who work in emergency care, who are contending with people who are elderly, frail elderly Canadians who also have dementia, and you're talking to the people who triage them, and you're talking to the people who deal on a daily level with the sort of ravages of dementia. One of the many things that was surprising was that was not all sad, right? It doesn't mean that the doctors and the nurses and the other workers weren't fully aware that what they were contending with was not something that anybody would ever want. They were fully aware of that. But there was joy there. And they talked about the patients themselves who were able to find their own joy, and the caregivers who were able to laugh with their mothers and fathers as they came in, that there was still real life, there. And I think maybe for those of us who are not facing dementia, that is a surprise, that you think the diagnosis comes down and your life goes a bit dark. A particular neurologist who owns a memory clinic here in Toronto, and she was talking about her own family experience. She's a grandmother, died of dementia, with dementia. She has a second grandmother who died of a heart attack but had been diagnosed with Alzheimer's. And this woman who owns this memory clinic, her mother lives with her now, and her mother has Alzheimer's disease, and it's fairly far advanced. And this doctor talked about how this is the gift and the grace of life, that it's her responsibility now to take what her mother has taught her over the decades and to take care of her mother's needs, but also to look at this disease as part of her mom's progression and part of who she is. And so let's make your life comfortable and say, isn't this wonderful that you are here and this is just part of you. But then she goes to the office during the day, and her role is to help people define their diagnosis. What kind of dementia are you dealing with? How do I manage your symptoms? How do we interact physically so that you get some kind of therapy happening with your caregiver in the room? She just was like, this is not a fatal, final diagnosis. It's just a new stage of your life. And I wasn't expecting that with her. It was lovely. I was surprised by how doctors will tell you things not for attribution or off the record. There were a handful of things that the nurses and the social workers that I got to meet through here said that sort of surprised me. So for example, a lot of services that Canadians get are by referral only, which means I can't call up and ask a neurologist to make an appointment for me. I must have a family doctor who does that for me. And we know that a lot of people don't have family doctors, but for the vast majority of elderly Canadians who are facing dementia, they have some kind of primary care healthcare worker who can make this referral for them. Sometimes these healthcare workers don't want to make the referral for whatever reason. A referral to a specialist is more expensive for the system overall. There are some family practitioners, I've been told, who believe, and this is a good thing, but they believe that they can handle a patient's dementia on their own, so no need to refer to an outside provider. So it's not always easy to just say, I would like a referral to a memory clinic. I would like a referral to a neurologist or a specialist who can administer an MRI or a CAT scan. I had thought that this would just be a matter of course, that'll happen. So then I find myself talking to a social worker saying, no, this isn't always the case. And when I ask her, well, what happens then if my mom's doctor won't, for whatever, refer me to you and I know your facility is where I need to be? She says to me, and again, she would not be quoted, but she had no problem with me talking about it in general. Go to a walk-in clinic and find another doctor and have them make that referral for you. If you don't have access to a walk-in clinic, go to a dermatologist, go to any doctor, a social worker, any medical practitioner of any sort, who, even if they are not yours, will make that referral for you. And her point was, keep trying, don't stop, you've got to keep going. And in case of dementia, she recognized that it's not the patient who's going to be doing that, right? She was talking to me as the potential daughter of somebody who would need these services. You need to work around, as opposed to the system here for you, you need to work around. So the referrals were one of the things that surprised me. The other one was that we have a system of community care access centers here in Toronto, and that's how people access a lot of the healthcare services that they would need if they have a dementia diagnosis. Those centers and how they respond to your care are really dependent on who directs those centers. So from one center to another, from one part of the city to another, you will have more or less accommodating, hospitable, timely responses depending on who's on the phone. So the social worker that you access through the hospital, for example, or perhaps your family doctor's office, is key for you, because she's going to get on the phone and she's going to call those people and say, I need you to go out to Mrs. Smith's house and evaluate how much help she'll get from a personal support worker, or how much help she'll get for daycare. Well, depending on who the person on the other end of the line is, you may or may not get those services. And even the social worker sometimes says, I have to put the phone down and wait and call back and hope I get somebody else. And so this is the, the sort of not so great side of the healthcare system, but recognizing every system is built on people. And so some people are more or less able or willing to give you what you need. And always the message was, you are your own advocate, you need to work the phones, you need to be on email, you need to be following up. If your family doctor says, I've made that referral for you, you still need to call that specialist and say, did my family doctor actually do that? It was interesting and a little disappointing, but good to know. One of the glowing shards of light in this process was recognizing what's available to all of us. And I hadn't really imagined that the quality of care that's out there existed and was available to those of us who were not paying extra, who were only accessing the public system. So doors were opening sort of figuratively and literally. So when I walked into a particular memory clinic that made me feel like this can't possibly be what's on the menu for me if I just walk in the door, and yet it was. And so the first step of finding out that you get a diagnosis, I would imagine you're not feeling so alone. Like right away, we can welcome you, come in. We are not going to rush you through a short 15-minute visit like so many Canadians are used to having with their family care doctors or their primary care practitioners. And you walk in and it could be 2 hours, 3 hours, 4 hours of testing, pen and paper testing, gentle questions to make you feel comfortable and figure out exactly what's happening. A social worker, a nurse practitioner, a gerontologist or a neurologist, whoever you need, and progressively you will need each one of those, being more experienced, to look you in the eye, tell you what's going on, do blood work, do a spinal tap, tell you when those results are coming, do them all in the same office so that you don't have to drive all over the city or make arrangements if you can't drive. Everything was available for you. And then at the end of it, you would have as much as science could give you. And this was not something that you had to drive to Buffalo to get. This was not something you had to mortgage your home to access. It was there. And I truly had no idea. And there wasn't only one memory clinic. There are a handful of them in my city alone. And then when you get on the phone and you talk to people who are out west and out east, they do exist. Now, there's a difference. If you're on the West Coast or Central Canada or the East Coast, there is a difference in terms of what's available. But the bottom line and the positive part was, my goodness, there is a lot here. And in there, dominated by people who care, obsessively care about how am I going to make your life better. And they want to make sure that your family comes in with you and that your spouse and children and anyone else who is involved in your care is present for these appointments so that they also can get help and education. It was mind-blowing to me how much was out there.